Hi everyone, my name is Antonia Osho. I will be doing the evaluation of our presentation tonight. After the teaching, it is expected that we evaluate our students. And tonight, our students will be our patients. So, we'll be using the following to evaluate the performance of our students. We will evaluate the teaching, if it was effective. And the first thing we're going to do, if patient is able to pass the post quiz with 80% or higher after the presentation, we'll know that the teaching is effective. If the patient can well list 3 factors that contribute to poor control of blood glucose level. Another thing we consider is if patients can list 2 physical problems that can occur because of reduced blood sugar control. We also use it to evaluate our teaching. We also put in our evaluation items that if our patient can demonstrate the proper blood sugar testing with the use of glucometer, then we will know that our teaching is effective. And lastly, if our patients can express a positive feeling regarding the diagnosis of diabetes and follow up with the lab works at the end of the presentation, we will definitely know that our teaching is being effective and is having positive impacts on our patients. We have 10 post-quiz questions. I just want to quickly go over them. The first one, number 1, a nurse is providing education to a client who is newly diagnosed with diabetes mellitus. Which of the following symptoms will she include when reviewing classic symptoms associated with diabetes? A, increased thirst, increasing hunger and increased urination. B, increased weight loss, increased dehydration and increased fatigue. C, loss of appetite, increased urination and increased dehydration. D, increased weight gain, increased appetite and increased thirst. Our answer here is A, increased thirst, increased hunger and increased urination. The rationale behind this is that increased thirst, when patients are thirsty and they are hungry and there is increase in urination, these 3 classic symptoms show to us that they're showing sign of diabetes mellitus, which is polyuria, polydipsia, and polyphagia. Weight loss, dehydration, and fatigue are additional symptoms. Question 2. Which of the following clients with type 1 diabetes is most likely to experience adequate glucose control? A, a client who skips breakfast when the glucose reading is greater than 220 milligram per deciliter. B, a client who never deviates from the prescribed dose of insulin. C, a client who adheres closely to a meal plan and meal schedule. D, a client who eliminates carbohydrates from the daily intake. The correct answer here is C, a client who adheres closely to the meal plan and the meal schedule. The rationale is that the therapeutic goal of diabetic management is to achieve normal blood glucose level without hypoglycemia. Therefore, diabetes management involves constant assessment and modification of treatment plan by the health professionals, and daily adjustments in therapy. Now we go to question 3. A client with type 1 diabetes has told the nurse that the client's most recent urine test for ketos was positive. What is the nurse's most plausible conclusion based on this assessment finding? A. The client should be told the next scheduled dose of insulin. B. The client should promptly eat some protein and carbohydrates. C. The client's insulin level are inadequate. D. The client will benefit from a dose of metformin. C is the correct answer here. The client's insulin level are inadequate. The rationale is that keto in the urine signifies that insulin is deficient here, and that control of type 1 diabetes is deteriorating. That means the control of diabetes type 1 is deteriorating. Withholding insulin or eating food will exacerbate the client's ketonuria. Metformin will not cause short-term resolution of hypoglycemia. And question 4. A client presents to the clinic reporting symptoms that suggest diabetes. What criteria would support checking blood level for the diagnosis of diabetes? A. Fasting plasma glucose greater than or equal to 126. Random plasma glucose greater than 150. Fasting plasma glucose greater than 116. Random plasma glucose greater than 126. A is the correct answer. Fasting plasma glucose greater than or equal to 126. Criteria for the diagnosis of diabetes include symptoms of diabetes plus random plasma glucose when it's greater than 200. 5. Question 5. A client newly diagnosed with type 2 diabetes is attending nutrition class. What general guideline should the nurse teach the clients at this class? A. Low fat generally indicates low sugar. Protein. B. Protein should consist 30% to 40% of calorie intake. C. Most calories should be derived from carbohydrates. D. Animal fats should be eliminated from the diet. Here, C is the right answer. Most calories should be derived from carbohydrates. The rationale is that for all levels of calorie intake, 50 to 60% of calories should be derived from carbohydrates, 20 to 30 from fats, and the remaining 10 to 20 from protein. Low fat does not automatically mean low sugar. Dietary animal fat does not need to be eliminated from the diet. Number 6 question. The nurse is teaching a patient about self-administration of insulin and is missing of regular and NPH insulin. Which of the following is important to include in the teaching plan? A. There is no longer a need to inject air into the bottle of insulin before insulin is withdrawn. B. When mixing insulin, the regular insulin is drawn up into the syringe first. C. If two different types of insulin are ordered, they need to be given in separate injections. D. When missing insulin, the NPH insulin is drawn up into the syringe first. B is the correct answer here. When missing insulin, the regular insulin is drawn up into the syringe first. And when rapid acting or short acting insulin are to be given simultaneously with long acting insulin, they are usually mixed together in same syringe. A longer acting insulin must be mixed thoroughly before drawing into the syringe. We normally give NPH and regular together, but we draw the regular first before the NPH. Then we give to the patient. Question 7. Question 7. A patient receives a daily injection of Lantus insulin at 7 a.m. When should the nurse monitor this patient for the hypoglycemic reaction? A. Between 8 a.m. and 10 a.m. B. This insulin has no peak action and does not cause hypoglycemia reaction. C. Between 7 and 9 p.m. D. Between 4 p.m. and 6 p.m. The correct answer is D. This insulin has no peak reaction. Oh, excuse me, the correct answer is D. B. This insulin has no peak action and does not cause hypoglycemia reaction immediately. Question 8 now. What is the only insulin that can be given intravenously? A. Lantus. B. Australentu. C. Regular. D. NPH. The correct answer is C. Regular. Regular insulin other than regular in suspension and can be given is the one that can be given in IV. But insulins that are suspension, cloudy like NPH should not be given through IV. Question 9. NPH is an example of which type of insulin? A. Intermediate acting. B. Short acting. C. Rapid acting. D. Long acting. Answer is A. NPH is an intermediate acting type of insulin. And the 10th question will be, which of the following statements is correct regarding Lantus insulin? That's the glargine insulin. A. It is absorbed rapidly. B. It is given twice daily. C. Its peak action occurs in 2 to 3 hours. D. It cannot be mixed with any other type of insulin. The correct answer here is D. It cannot be mixed with any other type of insulin. Even though it's clear like our regular insulin, but it's long acting. It is always given separately. So the correct answer is D. It cannot be mixed with any other type of insulin. So this is the 10 questions we'll be using to evaluate our students. Thank you.